Hi, my name is Megan Maddox, and I am going to be discussing Hutchinson-Gilford Progeria. Progeria was first described in 1886 by Jonathan Hutchinson. It was also described independently in 1897 by Hastings-Gilford. The condition was later named Hutchinson-Gilford Progeria syndrome. As of December 31st, 2019, the number of identified children living with progeria is 166 in 51 countries. Genetic origin of disease. Within the human DNA, there are 4 letters that are combined to make us who we are: A, T, C, and G. When DNA is combined, A and T are paired and C and G are paired. When a pairing set becomes altered, specific diseases arise. The cause of progeria is a single letter, a C that becomes a T in the middle of a gene called lamin A. This protein is a structural material that binds the nucleus of the cells together. This abnormal lamin A causes the diagnosis of progeria. I have included a picture of several children with progeria. As you can see, these children all share similar facial characteristics, which will be noted and discussed in the coming slides. Can this disease be inherited? Progeria is a result of the new mutations in the lamin gene and is unique in the way that it almost always occurs in people that do not contain a history of the disorder within their family. Hutchinson-Gilford progeria is an autosomal dominant condition. This simply means that one copy of the altered gene is powerful enough to cause this disorder. The photo to the left is an image of Adalia Rose and her family, obtained from her Facebook page. Adalia is the only one in her family diagnosed with progeria. Adalia is about 13 years old and is the oldest child in her family. She currently lives in Texas and uses her Facebook page and YouTube videos to help shed light on this disease, allowing the viewers to see how full of life and brave she is despite her daily challenges. The effect that the mutation has on the protein. Within lamin A, the C that became a T is the cause of the unique progeria traits. This includes premature aging, dwarfism, hair loss, hearing loss, and hypoplastic chin. The lamin is located within the nuclear matrix. The average lifespan is 13 years, with the average height being 100 centimeters, 39 inches, and weight of 12 to 15 kilograms, which equates to 26.5 to 33 pounds or less. This syndrome causes the rate of aging to be accelerated up to 7 times that of normal. This sporadic mutation leading to progeria has a reported incidence of 1 in 8 million births. This is an extremely rare disease. Symptoms of progeria. Progeria is characterized as the dramatic, rapid appearance of aging beginning in childhood. Those diagnosed with progeria will appear normal at birth, yet shortly after birth, their rate of growth will significantly be slower than that of a normal child. They will then begin to develop the facial characteristics with this diagnosis: a thin beaked-tipped nose, prominent eyes, thin lips, a small chin, and protruding ears. These children will also experience hair loss, aged-looking skin, joint abnormalities, and loss of subcutaneous fat. While these children face many physical abnormalities, they do not have a hindered development of intellectual or motor skills. Progeria does not affect a child's mind. Children with this disorder are the same as other children in respect to intelligence and learning and wanting to be a part of the world around them. Some with this condition may experience arteriosclerosis, increasing their chance of heart attack or stroke at a young age. Arteriosclerosis is the thickening and hardening of the walls of the arteries, occurring typically in old age, meaning it is also seen in progeria patients as this is an aging disease. Treatment options for progeria. Progeria is a lifelong condition, meaning that there is no cure. With this condition, it is important to monitor the heart and blood vessels, helping to monitor the child's condition. The below therapies are often used to ease or delay some of the signs and symptoms depending on the child's condition and symptoms. Low-dose aspirin, medications, physical and occupational therapy, nutrition, and dental care. Low-dose aspirin may help prevent heart attacks and strokes. For other medications, depending on your child's condition, the doctor may prescribe other medications such as statins to lower cholesterol, drugs to lower blood pressure, anticoagulants to help prevent blood clots, and medications to treat headaches and seizures. Physical and occupational therapy may help with joint stiffness and hip problems to help your child remain active. Nutritious, high-calorie foods and supplements can help maintain adequate nutrition. Dental problems are common in progeria. Consultation with a pediatric dentist experienced with progeria is recommended. Looking to the future, research is advancing to understand this disease and to help search for and identify new treatment options. Resource information for progeria. Progeria is a lifelong diagnosis, and unfortunately, there is no treatment. However, there are some items that are often used to assist those with this disease. Hearing aids and glasses are often used as these children often experience a decline in their hearing and vision. Car seats are also a necessity for traveling to keep these children safe. Case managers and social workers are available to help assist families in the purchasing of these devices. Your child's doctor will work closely with you and your child to recommend any assistive devices that may improve the quality of life for the child as the need may arise. Changes within the home of those with progeria. Due to the small and fragile stature, some clothing may have to be specially made, using materials and cottons that will not irritate their sensitive skin. This includes pants with adjustable waistbands as their waist remains much smaller than typical. Within the home, installation of lever-type taps, lowering of coat hooks, light switches, door handles, adding smaller handrails below the normal ones on the stairs, use of memory foam mattresses, keeping step stools handy for counters and toileting, and keeping the furniture arranged in a position comfortable for the child. When traveling, be aware to use a memory foam car seat. Hard plastic car seats can be damaging on their sensitive skin and joints. And be aware of how easily the child may tire. Most families will set aside times to allow the child to nap and recover before continuing on their journey. While progeria can significantly shorten a person's lifespan, this does not mean that they can't have a happy and fulfilling life. It is no lie that living with progeria can result in serious challenges. But these children can still attend school, have jobs, form and maintain deep relationships, engage in meaningful hobbies, and live life to the fullest with the love of their family assisting along their journey. These sources were used in the conduction of this presentation and can be accessed for more information regarding progeria.